Vitamin K, Mark Lorenzato, MD, paleolegacy.com. Vitamin K represents a group of molecules. They are all quinones, and in many aspects they have similarity to CoQ10 or ubiquinone. Your vitamin K1 to K2 ratio, something that is not measured clinically, is likely to have an optimal range determined by our paleolegacy. Science and time will tell. The vitamin Ks are fat soluble. Vitamin K2 is more likely to be involved in fatty membranes than K1 due to its structure. Vitamin K1 is found mostly in leafy green vegetables, in green vegetables in general, and K2 is found in the fermentation as the fermentation product of some foods, such as natto found in a soy fermentation product. Also found in some cheeses, such as Gouda, Emmental, and Jarlsberg. And probably most significantly from our paleo legacy, when game animals eat greens, they convert K1 to K2. So when humans survived more on game animals, they got a greater portion of vitamin K2 in their food supply from the game animals they ate. This supply is now lacking unless you eat range-fed animals. Involved in blood clotting. Vitamin K in excess will reverse the effects of the blood thinning agents warfarin. Blood thinning is a misnomer. These agents do not change the viscosity of your blood, but they prevent clotting. And vitamin K will undo those medications. So a person taking a medication to prevent clotting, such as warfarin, known as Coumadin, or other similar medications, needs to proceed very cautiously and not take extra K1. Perhaps they'll take K2. That is to be discussed with your practitioners. Vitamin Ks work through modification of amino acids on various proteins involved in the clotting system. These modifications then ultimately result in different binding with calcium, and these affect how the blood clotting agents fit together and group and become effective mechanistically. Vitamin K is required for the modification of clotting factors 2, 7, 9, 10, protein C, protein S, and protein Z, in case you have a deficiency of these. Other roles. Vitamin K2 has a prominent role in bone health and bone growth and maintenance, and prevention of osteoporosis. It has a role in the prevention of calcium deposition in soft tissue. Without vitamin K2, we tend to deposit calcium into ligaments and the collagen fiber in vasculature in our blood vessels and such. This is known as the calcium paradox. In an individual you give more calcium to without sufficient K2, they will calcify not their bone but their soft tissue. Vitamin K2 deficiency can manifest as calcium deficiency in teeth, for instance, with whitening white spots of the teeth. Adequate vitamin K2 is essential for good blood clotting dynamics in the brain, and it seems to have a neuroprotective effect, probably for its benefit in the harmony of certain lipids, sphingolipids, in the membranes of our nervous system. This is a large group of molecules that are predominant in our membranes. Vitamin K2 can inhibit angiogenesis, meaning that new blood vessel growth, particularly as seen in cancers, can be inhibited with adequate vitamin K2. Another way of putting this is vitamin K2 deficiency contributes to the progression of cancers at a young stage. All these things fit within the model of our paleo legacy, suggesting that getting the right balance of vitamin K2 or vitamin K1 to K2 is very important. Other benefits of vitamin K2 include studies that showed in viral hepatitis there is less development of hepatocellular carcinoma, of cancer of the liver. There is a relatively high rate in chronic hepatitis B and C of hepatocellular cancers of the liver. This is greatly diminished in the few studies, or the study that we have. Cirrhosis of the liver creates a deficiency of the vitamin Ks and can present as blood clotting problems, for instance, and vitamin K1 and K2 should be given in this case. There's significant speculation that higher levels of K2 can slow the progression of many cancers if they're in the early stages. Supplementation, if needed, harmonizes with our paleo legacy when humans obtain K2 through ingestion of red meats from ruminants. Recommendations. If not taking warfarin or other medications designed to affect your blood, vitamin K2 at 100 micrograms daily, unless getting K2 from fermentation products such as natto or meats or cheeses as discussed. But even then, there doesn't seem to be an upward limit of K2 reasonably if you take 100 micrograms additional. It's probably not a problem. Once again, vitamin K2 reverses the effect of blood clotting agents such as warfarin. Be cautious, but K2 may be of great benefit because agents that, such as warfarin, do contribute to bone loss and probably neurodegeneration and other problems. When taking vitamin K2 as an adjunct to the management or prevention of osteoporosis, or when taking it for inhibiting angiogenesis due to a risk of cancer or cancer prevention or cancer management, a comprehensive approach is suggested rather than just taking a supplement. Monitoring the effects of K2. When coming off an anticoagulation medicine, you need to consult your health practitioner, and usually the INR is a test used to monitor this. Daily vitamin K2 supplementation affects levels of the undercarboxylated osteocalcin, which we see relative to bone breakdown, and therefore it could be used as monitoring, but from insurance reasons it's usually not used, and instead C-telopeptide is used. C-telopeptide, a measure of bone reabsorption, is less beneficial than osteocalcin, but is generally paid for by insurance companies and is effective if taken serially. Other factors affecting clotting: salicylates, aspirin can block the effects of K. The omega-3s DHA and EPA have an effect on clotting. Excessive EPA and DHA prolong blood clotting times. And blood vessel wall integrity and elasticity is affected by vitamin C. Deficiency of vitamin C can lead to bleeding. Vitamin K deficiencies are common in program deficiencies. When you have a patient, an individual, not get leafy green vegetables, parsley particularly, spinach, kale, and such, because they're on warfarin or such. There are many problems of this strategy, and it may be better to supplement with some K2 and stay off K1 and then adjust the warfarin for that level. The jury's not out. Fat malabsorption from either gallbladder disease or pancreatic disease or other will affect you not absorbing K2. This is problematic. Inflammatory bowel disease can lead to increased bleeding and loss of K2 for this. Liver disease will prohibit the liver disease affects K2 in several ways, including the construction of the blood clotting agents. Dietary influences clearly are a strong factor influencing K2 deficiencies. People that don't get enough food in general are going to be K deficient, and specifically if a person does not get a balanced vegetable rich and range-fed game meat diet or something similar, they will be K2 deficient. Antibiotic use will affect the fermentation in the gut and therefore affects vitamin K2 levels. Recommended supplements. Paleo legacy supplements include vitamin D3 and, depending upon diet, DHA and EPA, conjugated linoleic acids sometimes, L-carnitine, L-carnosine, creatine, nicotinamide, choline, vitamin K2, vitamin B12, and others. Vitamin K2 is taken in a capsule form at 100 micrograms per day, generally, or 50 micrograms per day, perhaps, if taking Coumadin or warfarin or another blood thinning agent. Spark Lorenzato for Paleo Legacy. Thank you.